GULAFSHAN. She will be speaking on analysis of clinical profile in aggressive ROP in tertiary care hospital. I don't know.
Good morning all. My topic is on analysis of clinical profile in AROP in tertiary care hospital. So we all know retinopathy of prematurity is a vasoproliferative retinopathy that affects the developing retinal blood vessels of the premature babies. It's a leading cause of avoidable blindness worldwide, with the prevalence being 18.4% in India. According to the recent ICMR classification, AROP can occur at any stage of classical ROP. Thus, it is defined as increased dilatation, tortuosity of vessels in all quadrants out of proportion to the peripheral. Retinopathy changes like flat fibrovascular proliferation, neovascularization, rapidly progressive course. The common age of presentation 32 to 34.
You're not the presenting author, no, as mentioned in this?
I am the chief author, ma'am. She has a health issue.
Have you taken the permission?
Yes.
Change of author is allowed only by AIOS, and then only it can
Yes, we had mailed and taken permission, ma'am.
Okay.
And the PPT also is uploaded in my AIOS account.
So you watch, doctor?
Hemlata. Hemlata. The common age of presentation being 32 to 34 weeks after conception, with an incidence of around 2.5% in Western population, while in Indian population it is 10% to 12%. So the aim of the objective of our study to analyze these AROP babies and then associated risk factors. So coming to the result, among the 945 babies which we have screened, 84 babies were found to have ROP. Thus the incidence is around AROP 11.25%. The mean gestational age group is 29 weeks plus or minus 2 weeks. The lowest being 27 and the highest around 33 weeks. And the mean birth weight is 1.46 kg, lowest 0.9 and the highest is 1.7. The associated risk factors are respiratory distress syndrome, 45%, long NICU stay, 50% poor weight gain, 45% anemia, 36%, and very low birth weight and septicemia were seen in 22%. And the blood transfusion history is among 7 babies. The results, in the fundus picture, we can see there is a lot of zone 1 ROP in the right side with popcorn lesions and looping temporal slope, and the flat neovascularization peripheral avascular zone. And the associated maternal factors were elderly primary 40%, diabetic 26%, prolonged duration of labor 22%, and hypertension 13%. Zone 1 and Zone 2 ROP when we saw, Zone 1 were 46 babies and Zone 2 38 babies. And the NVI, that is neovascularization, was seen around 30%. And 9%, that is 8 babies who didn't have good dilatation due to aggressive NVI, underwent anti-VEGF injection, that is ranibizumab. And 32 babies needed 2 to 3 sittings of laser. So these are the pictures where in the first we can see the hemorrhages with zone 2 posterior here, and these are multiple hemorrhages with shunting of vessels, peripheral looping, and this is zone 1 with extensive avascularity. And when we subcategorize the zone 1 and zone 2 babies, we saw like the low birth weight, NICU stay, neovascularization, temporal notch, and hemorrhages were more obvious seen in zone 1 babies. Zone 2 posterior, more of hemorrhages and vascular loops were noted. And here these are the peripheral vascular loops on the right side, and this post-laser well-stabilized fundus photograph. So coming to the discussion, in our study, the mean gestational age is 29 weeks with the birth weight of 1.7 kg in comparison with the Behra et al., where their 1.7 kg and the mean weeks is around 31 plus or minus 2 weeks. And the sepsis incidence is around 35%, and in our result it is around 22.7%. And AROP, when we saw zone 1 and zone 2 comparison, the vascular tortuosity, aggressive neovascularization, and notching was obvious in zone 1, whereas vascular looping and junctional hemorrhages were seen in zone 2 posterior babies. The prolonged oxygen exposure is one of the risk factors, and in our study it is around 36%, whereas Jalali et al. It is 24%. In our study, most of the babies were managed with laser treatment, though many required, like around 23% required more than 1 sittings of laser, which is comparable with that of Han et al., where 33% of the babies need multiple sittings of laser. And especially when the babies are very sick, and we had to plan and zone 1 babies. In our study, only 9% underwent anti-veg injection because of poor dilatation and media hazy, which were followed with laser after 6 weeks. We also recommend zone 1, we can go for anti-veg injection. Thus, to conclude, with good NICU care, more babies being surviving, it's very important to not to miss the AROP babies and to treat the associated risk factors along with the eye. Thank you.
So you said that most of the babies underwent laser for aggressive ROP. Why not anti-VEGF, which is now most like a first-line treatment?
Sir, we don't have Avastin, sir, like we are giving Razumab. And also many of the babies, we saw the recurrence is too high. Within 2 weeks, there will be recurrences. And ours is a government setup also. And another thing which I saw is conjunctivitis. So whenever suspected neonatal conjunctivitis, some babies we didn't prefer to do. So there I planned for more sittings of laser. And only when the requirement, we went for the injection, sir. Thank you, sir.